The notion that vaccines are propaganda and actually make you weak and sick is a misleading and potentially harmful concept that has been perpetuated by certain groups and individuals. This ideology is often rooted in misinformation, misconceptions, and a lack of understanding about the science behind vaccines. In reality, vaccines have been extensively tested, proven to be safe, and have played a crucial role in preventing the spread of infectious diseases, saving countless lives, and improving public health. One of the primary concerns raised by anti-vaccine proponents is that vaccines contain harmful ingredients, such as mercury, aluminum, and formaldehyde, which can cause adverse reactions and long-term health problems. However, numerous scientific studies have demonstrated that the amounts of these ingredients present in vaccines are negligible and do not pose a significant risk to human health. For example, the mercury-based preservative thimerosal, which was previously used in some vaccines, has been largely phased out and is no longer used in most vaccines. Moreover, extensive research has shown that there is no causal link between vaccine ingredients and the development of chronic diseases such as autism, cancer, or neurological disorders. Another myth perpetuated by anti-vaccine groups is that vaccines weaken the immune system and make individuals more susceptible to illness. This claim is based on a fundamental misunderstanding of how vaccines work. Vaccines introduce a small, harmless piece of a pathogen, such as a virus or bacteria, to the body, which triggers an immune response and enables the immune system to recognize and fight the disease-causing agent. This process does not weaken the immune system, rather, it strengthens it by providing a targeted and controlled exposure to the pathogen, allowing the immune system to develop a specific response. Additionally, the concept of herd immunity is often overlooked by anti-vaccine proponents. Herd immunity refers to the protection afforded to a community when a sufficient percentage of the population is immunized, thereby preventing the spread of infectious diseases. When a significant portion of the population is vaccinated, it creates a barrier that protects vulnerable individuals such as the elderly, young children, and those with compromised immune systems who may not be able to receive vaccines or may be more susceptible to severe disease. By not vaccinated, individuals not only put themselves at risk but also jeopardize the health and well-being of others around them. It is also important to recognize that the benefits of vaccination far outweigh the risks. Vaccines have been instrumental in eradicating or significantly reducing the incidence of numerous infectious diseases, such as smallpox, polio, measles, and whooping cough. According to the World Health Organization (WHO), vaccines have saved an estimated 10 million lives between 2010 and 2015 alone. Furthermore, vaccines have also been shown to have a significant impact on reducing the economic burden associated with infectious diseases, as well as improving overall public health and well-being. In conclusion, the idea that vaccines are propaganda and make you weak and sick is a misguided and unsubstantiated claim. Vaccines have been extensively tested, proven to be safe, and have played a vital role in preventing the spread of infectious diseases and improving public health. Rather than relying on misinformation and misconceptions, it is essential to consult credible sources such as the Centers for Disease Control and Prevention (CDC), the WHO, and peer-reviewed scientific literature to understand the benefits and risks associated with vaccination. By making informed decisions and getting vaccinated, individuals can protect not only their own health but also the health and well-being of those around them.